Hello, my name is Christine Sue.
And I'm Lynn Nguyen.
And we are student pharmacists at the University of Texas College of Pharmacy. There are many things that people should know about over-the-counter products that can make their lives much easier.
It can be dangerous if you take too much of an over-the-counter medication, or if you don't know that a medication causes drowsiness.
Pharmacists are a great resource to ensure that you and your family are taking the appropriate amount of the right product for the right ailment.
You can save money on generics that have the same active ingredient and effectiveness as the more expensive brand name.
80% of consumers use over-the-counter products to relieve symptoms without having to see a doctor. That's a lot of people. So we are wondering, how much do people actually know about what they are taking?
So we went to a pharmacy and asked people browsing the over-the-counter aisles a few simple questions.
Let's see how much they know.
Go take it slow. Show me that you
Go ahead. Okay.
Fixing my hair.
Have you ever used an over-the-counter medication for your headaches?
Yes.
Which medication have you used?
I use Tylenol.
Have you ever heard of acetaminophen? What's the difference between Advil and ibuprofen?
That's a good question. Advil, ibuprofen, what's an aspirin? What's non-aspirin?
Let's see. Advil's more of a painkiller, whereas ibuprofen reduces swelling.
What is the difference between acetaminophen and Tylenol?
I don't know that medicine. I know about Tylenol, but the other one.
Ibuprofen is a anti-inflammatory steroid. No, not steroid. It's just an anti-inflammatory. And Advil is I don't know. No, they're the same. No, they're not the same.
My name is Renee Acosta. I'm a clinical associate professor at the University of Texas College of Pharmacy. Many patients don't understand the difference between brand and generic. In an over-the-counter market, usually you have a brand name that's sitting on the shelf with a house brand or a generic that sits right beside it. Of course, always ask your pharmacist to make sure that the two products are the same. But the easiest way to tell is to simply flip your boxes over and compare ingredients. As long as the drug is the same and the same strength, then they should be equivalent and they should work the same in the body.
Do you know how many milliliters are in a teaspoon?
Mamita. Talking in Spanish. No, I don't remember. Is it a teaspoon?
Milliliters in a teaspoon.
Okay. I'd say 4.
4.
Do you know how many milliliters are in a teaspoon?
No, I do not.
I have no idea.
Thank you very much.
Is that it?
Yes, that's it.
Okay.
Do you know how many milliliters are in a teaspoon?
Teaspoon is 100 milliliters.
How many milliliters are in a teaspoon?
5.
Okay.
No. 1. No. 5.
Whenever you buy a liquid medication, it's always important to either ask the pharmacist for a dosing syringe or use the dosing cup or syringe or dropper that came with the liquid medication. Sometimes when we get home, we get ready to take a medication, we get a spoon out of the drawer, or we just open the bottle and drink what we think is the right amount. That's not the right way to get the correct dose. So use whatever came with it from the manufacturer, or ask your pharmacist for a syringe and ask them to show you exactly how much of the medication you should take so that you get the right amount.
Hello, I'm Len Chrisman, Dean of the College of Pharmacy at the University of Texas at Austin. I'm here to tell you that pharmacists are critical members of the healthcare team. They provide consumers with important patient care services and a variety of different kinds of healthcare environments. Most people are most familiar with pharmacists filling their prescriptions, but pharmacists provide many other types of services. Pharmacists counsel patients about how to take their medications appropriately, about adverse effects, and about drug interactions. Pharmacists manage patients' therapeutic regimens. They perform medication reviews, notify prescribers of potential problems with the therapeutic regimen, educate those patients about those changes, and in some situations, they provide the total collaborative disease management. Community pharmacists also provide important services in helping patients with self-care. They help patients pick out the most appropriate products for acute ailments that can be treated with non-prescription products. They help patients with diagnostic devices that can be bought over the counter, and with self-monitoring devices for a variety of different disease states. And finally, pharmacists help patients with durable medical equipment to help meet needs that they have for chronic illnesses. So pharmacists, voice your value and hook 'em.
Voice your value.
Voice your value.
Nicotine.